Hi, my name is Mark Pearson and this is my story. In January 2020, I was in a car crash. I walked away from the crash completely fine, or so I thought. 6 weeks after the crash, I was rushed to Beaumont Hospital for emergency brain surgery. I had developed hydrocephalus as a result of the crash. Hydrocephalus is a condition where cerebrospinal fluid builds up in the brain. This extra fluid causes an increase in pressure in the brain. Hydrocephalus is most commonly treated with a shunt. A shunt is a small device which is inserted into the third ventricle of the brain and helps to drain the fluid to the abdomen. The problem with shunts is they have a 50% failure rate in the first 2 years and a 98% failure rate in the first 10 years. When a shunt malfunctions, the patient gets a headache. Unfortunately, these headaches feel the same as normal headaches. The current solution for determining the cause of the headache is to travel to a hospital for a CT scan or an X-ray. This is where Cervello comes in. Cervello is a sensor which attaches to the shunt. The sensor measures the rate of flow of fluid exiting the shunt. Shunt malfunction results in a change of flow rate of the fluid. If the shunt is blocked, less fluid will be drained. Each person has an optimum rate of flow, which is determined by the neurosurgeons when the shunt is placed. This sensor will detect the flow rate and relay this information back to a device. This device then displays the information for the patient to see. When a patient gets a headache, they immediately think the worst. They begin worrying that their shunt is malfunctioning and fear they will have to undergo more surgery. If the patient has Cervello, they can check their shunt straight away without going to a hospital. Cervello will make a huge improvement to the quality of life for hydrocephalus patients.